After birth, the umbilical cord is cut off. The circulation of the fetal blood through the placenta ceases. Accompanied by the cry of the baby, the lungs begin to expand and begin to function. The placenta is no longer needed. The circulation pathway changes greatly. The first change is the closure of the umbilical vein. After birth, the umbilical vein is obliterated and forms the ligament of the teres hepatis. The second change is the closure of the umbilical artery. The distal parts of the umbilical arteries form the lateral umbilical ligaments, as the proximal portion remain open as the superior vesical arteries. And the third change is the closure of the ductus venosus. Ductus venosus extends from the ligament teres hepatis to the inferior vena cava. After birth, it's also obliterated and forms the ligamentum venosum, lying between the portal vein and inferior vena cava. As the fourth change is the closure of the ductus arteriosus. After birth, the high content of oxygen in the blood stimulates the smooth muscle in the wall of the ductus arteriosus, constrict continuously. About 2 or 3 months later, ductus arteriosus is structurally closed and forms ligamentum arteriosum. If it remains patent after 3 months, this is patent ductus arteriosus. Aortic blood is shunted into the pulmonary artery, causing the overloading of the pulmonary artery. Cardioangiography is always used for the diagnosis. A shunt from the aorta to the pulmonary artery can be seen clearly. It has been reported that high prostaglandin is one important cause of the failure of the contraction of the smooth muscle in the wall of the ductus arteriosus. Thus, clinically, prostaglandin inhibitors are used for the treatment of the patent ductus arteriosus. If prostaglandin inhibitors don't work, surgery is needed for the treatment of the patent ductus arteriosus. Transcatheter technique is also used for the patent ductus arteriosus. The last change is the closure of the foramen ovale. After birth, pulmonary circulation is established. The pressure in the left atrium is higher than the pressure in the right atrium. The increased left atrial pressure presses the remaining parts of the septum primum closely against the septum secundum. Gradually, these two septums fuse with each other. It usually happens in about 1 year after birth. In 20% of the individuals, foramen ovale fails to close, which causes atrial septal defect. Well, the above-mentioned is the fetal circulation and changes after birth. Now, share one case. A female infant was born after pregnancy complicated by a rubella infection during the first trimester. She had congenital cataracts and congenital heart disease. A radiography of the infant's chest at 3 weeks showed generalized cardiac enlargement with some increase in pulmonary vascularity. What congenital cardiovascular defect is commonly associated with maternal rubella infection during the early pregnancy, and what probably caused the cardiac enlargement? Please leave your comments in the discussion area. Thanks for listening. See you next time.